I'm learning that we're really, really missing is our administrators.
Mm-hmm.
I think our coaches and our artists are becoming more knowledgeable about health and wellness, but
Mm-hmm.
then when they go out and work, it's up to them to provide those services for themselves oftentimes.
Yeah.
And our artists are not making an amazing living. So,
Unfortunately.
they're already stretched. And so for them to have to take that burden on top of that is really, really tough. So until we do a better job of educating the administrators and the people that make the decisions about applying for grants and whether or not to include healthcare services in grants, that's something I think that's more common in dance that we don't see happening in circus companies. And until they also see the value of having healthcare services for their artists, beyond just having health insurance, because it's different from general healthcare to have someone that understands what you do, and when you're injured that you need to get back to work quickly or you don't earn a living, and knowing
Right.
how to do that in the context of the circus arts is important. So allowing people to see those practitioners. And there's some great examples in dance. They're a bit dated at this point, but Boston Ballet and Alvin Ailey both did studies looking at the cost savings of bringing healthcare in-house, and showed that it saved them a lot of money as far as workers' comp, versus having their dancers just go out to private practitioners. Because also, if you have people in-house, they can collaborate with the coaches, the directors. You can work together as a team to take care of the artist, versus the artist being responsible for telling their coaches or their director what the healthcare provider said, and that sort of game of telephone that is really, really difficult.
Mm-hmm.
But again, we don't have those studies in the circus arts to show that efficacy. And so when companies are strapped, and unfortunately that's going to get worse, right? And
Unfortunately.
they're making really hard decisions already on how to stay afloat. Healthcare is not something we're seeing a lot of companies prioritize as far as what to spend money on for their artists. And so to change that, we've got to show them the value. And when you're in the management side, the value is always often around the money. So,
Right.
but from a researcher and a healthcare provider, I get that's important. But what I care about is that our artists are thriving. They're not just managed, they don't have to be suffering. I think we need to get out of that mentality that it's just normal to be broken.
Yeah.
Yes, injuries
Mm-hmm.
happen, but we can take better care of people so they can feel better, so they can recover better, so they can have better mental health and enjoy their lives as well as their art. And we'll see better art that way too.